Dark circles around the eyes can be caused by many factors. I think in our local population, one of the most common factors is that of pigmentation. Certain people have hereditary pigmentation around the eye. So if you look at their parents, grandparents, they will have this predisposition to have pigmentation around the eyes. And this is one of the reasons for dark circles. The other reason for dark circles is that the skin around the eyes are very thin, and beneath this skin is the blood vessels. So sometimes, because of the thinness of the skin, the blood vessels and the reddish appearance of the muscle can actually show through, be revealed through the thin skin, and it can appear as if it is dark circles. The third reason is that some people complain of dark circles because of excessively wrinkled skin. For example, if their skin is very thin and wrinkled, these fine wrinkles, what happens is that when the light hits on the skin, it doesn't reflect. The reflective surface is not like the cheek skin, so it doesn't reflect the skin as well. And when the skin is very wrinkled, the light is reflected many ways, and it looks dark in color. So actually it's not really caused by pigmentation or vascularity, but it's caused by wrinkled appearance of the skin. Dark eye circles can be made worse by a lack of sleep or fatigue. The reason is, when we are tired, the facial muscles are all similarly tired as well. So the muscles around the eyes, they become looser, and if you already have a little bit of eye bag, you can actually have a little bit more sagging of the eye. The skin will become a little bit more wrinkled in appearance, and the eye bag can become bigger, so it can look as if there's more dark eye circles when a person is fatigued or has not slept well. The last cause of a dark circle is eye bag. Same thing. An eye bag can cause a line around the eyes, lower part of the eye, and because of the light that is shining down, it can cause a shadow in that area. And frequently, because these patients also have a little bit of loose skin and wrinkled skin, this can give the appearance of dark circles as well. But these are not really real dark circles as we commonly understand it to be. Dark circles are most commonly associated with pigmentation as well as vascular problems. If a person has eye bags, it is quite clear that you can actually improve the dark circles. The problem is when the person doesn't have eye bags or wrinkled skin, that it becomes more difficult to treat these dark circles. So when a person has eye bags and they want to understand whether or not the dark circles are whether the eye bag is actually contributing to the dark circles, they can actually stretch out the skin here a little bit, and they can look and see whether the tightening of the skin and the reduction of eye bag actually cause a reduction in the appearance of dark circles. If that is the case, then you can actually do surgery, or you can actually tighten the skin with peels and all that to reduce the wrinkle appearance, to improve the appearance of the dark circles. So that's one way you can actually differentiate between eye bags or wrinkled skin causing dark circles versus pigmentation or increased vascularity causing dark circles. Dark eye circles are usually treated a few ways. The most common way is to use creams to put over the dark eye circles. What happens with these creams is that it is used to thicken the skin by increasing collagen, stimulating more collagen formation, or to thicken the skin such that is more firm and is less wrinkled in appearance. Frequently, after a certain period of use, the creams are not very effective anymore, and then the patients will come and see us for fillers, or these fillers can be used to thicken the skin and can be used to reduce the appearance of contributory factors such as eye bags. And also, when you use fillers, you can actually lift up the cheek, and because the cheek is more visible in appearance, it can actually reduce the emphasis on the dark eye circles. The third way to treat dark eye circles is to use threads which are placed into the eyelid itself. These threads, they have properties which can reduce the pigmentation as well as to increase the thickness of the skin. The other and last way to treat dark eye circles is the use of nanofat, and we do nanofat by extracting some fat from the person's body and using that fat to process into nanofat and then re-injecting that into the eyelid skin.